Good evening. So we're conducting this interview in order to learn about a certain type of profession. If you don't mind, can you please introduce yourself before we begin?
Sure. I'm Richard Mabry. I'm an optometrist here in Austin, Texas.
All right, that sounds great. So can you please tell us what exactly is an optometrist?
Optometrist is an eye doctor. We don't do surgery is the main difference between us and ophthalmologist. We do complete comprehensive eye exams. We both treat eye disease. We both prescribe medications. We do pretty much all the similar things other than ophthalmologist does surgery and we don't.
So why have you decided to become an optometrist, and where did your passion stem from?
Sure. I did a lot of externships when I was at UT in different doctor's offices, and I found I was not down with seeing people bleed. And so it made me want to faint. And so that part of the profession was X'd off the list, so no more medical school. And then I have to say, I looked into podiatry and I looked into dentistry, and I didn't want to smell people's breath for the rest of my life, and I didn't want people's feet either. So optometry began, I worked with an optometrist in a group called Prevent Blindness, doing screenings for glaucoma, and I really found that's what I liked. That's how I got into optometry.
Can you tell us the process and how long it takes to become an optometrist?
Sure. So you have to do your undergrad prereqs. It can be 3 or 4 years. Most of us have a 4-year degree when you go to optometry school. And it's another 4 years. So just like medical school, the first 2 years you're doing medical school classes with med students and dental students for a lot of it. So you're going to repeat biochemistry and some other things, anatomy, cell biology, and other things. So. Then you also have your own individual classes you're taking at the same time in clinic rotations.
Can you describe your experience in undergrad in optometry school?
Sure. I did UT as undergrad. A UT student like everybody else, you kind of a number, and you got to learn, basically self-taught, for a lot of the courses because they're so massive. You read the textbook and teach yourself the material. You got to take the was it OAT? I think it's the optometry exam. It's been 20 years, so I think that's what it's called. You got to do well enough on that to get in. So we said. Then you do your 4 years at your whatever school you wind up getting into. There's more choices now than when I was around. There's only 17 optometry schools when I applied, and UT had no pre-optometry group at all. They were asking me why I was at UT when I was asking about it. Why did you go to UH? I don't know. Didn't know I wanted to be an optometrist when I started.
Can you tell us about the optometry admission test and the licensing exam, and then how was the process for you?
Now the optometry, for optometry school, it was kind of like the MCAT. It's very similar in the dental test too. I don't know what it's called either, because I took that one also just to see. They're all pretty similar tests. They're basically going back over all the undergrad classes you took to see what you remember. So as far as the board exams at optometry school, those are definitely a little more stressful because you're taking your regular course load along with taking the board exams, and you do it as you go through school. And so you start your board exams like your 3rd year in school. You start taking your basic board exams. The basic board exams are like taking the OAT over again, except now you're more specified for what you've been learning. And they're very picky on the knowledge base that you have to have. And they pick really obscure things out that most people would not remember. So it's very stressful. I would say for most schools, like my class, we probably had 80% plus pass the stage 1 of the boards the first time around. There was other people in my class that took it 3, 4, 5 times to pass it. And then you have to pass that before you can go on to the next stage, the stage 2 and stage 3 of the boards. So they're kind of stressful, but they are what they are. And the last stage is you're doing a clinic rotation where they actually have you sit down and have a doctor watching you do specific tasks with patients. And I've been a board examiner where you sit in with the students and watch them do it. So.
Before you became an optometrist, did you do any shadowing? And if so, can you describe how your experience was?
Sure. Dr. David Starnes was here in Austin for a long time. He's passed away now, but he had a practice down in South Austin. And he's the doctor I worked with initially at UT. He was part of Prevent Blindness, the group that I got into, and I met him through that. And I started just shadowing him a little bit, and got to know him very well. And he was kind of my mentor.
Can you tell us a typical day in the life of an optometrist?
Sure. Practices vary. I work in somewhat of a commercial practice, and so I rent my space from the corporation next door. You can certainly have a private practice also. You can have a solo practice, you can have a group practice. There's many variations. I'm the managing doctor at this office. We have a large group. We have 7 offices here in Austin, and we have another 6 in Dallas in our group alone. And so I manage this office and have done for the last 11 years. And so I not only am seeing patients here, I also do admin stuff, and then I oversee the scheduling, payroll, everything else day to day that goes on here. And then we do reports throughout the month and report back to the head of the company. So I work for another doctor. So.
What are some procedures that an optometrist performs?
Well, basic procedures we perform are, refraction, using the phoropter up here to make sure people can see properly. Simply said, that's the number one thing we do is glasses and contact lenses, contact lens fitting. We also do the health exam, which is what the slit lamp is for. We check, make sure everybody's eyes are healthy front and back. Our office has a lot of high-tech equipment, and so we have ocular fundus cameras. We have 2 different cameras. We have an OCT, which uses sound waves to basically look at retinal disease. So there's lots of different things. I manage glaucoma. I'm a glaucoma specialist, so I do a lot of glaucoma patients. We do foreign body removal, which people get the stuff stuck in the front of their eye, little pieces of metal and things like that, doing various whatever activities they do, and we dig those out for them. So there's lots of different things we can manage and do.
What are some machines that you think are vital when doing checkups or in general for looking at the eye?
Well, the fundus cameras are absolutely necessary now, I think, day to day, because they are very accurate and they pick up stuff that maybe you might miss because it's very subtle in some of the things. So I think having the fundus camera is something you must have. Having an OCT, I think, is going to be that way in the future. It's already for our practice. We have the OCT machine, and we do that a lot on patients when they have retinal issues or glaucoma, macular degeneration, lots of things. It measures in microns, which I can't see. So.
Can you describe the function of the eye and how it works and why it's so important to get daily regular
yearly
checkups?
Yeah. So check yearly, see clearly is kind of a slogan for an organization out there that promotes yearly eye exams. The retina specifically is a direct outgrowth of the brain. Mm-hmm. It's connected to the brain directly. It's about 3 inches behind you. Mm-hmm. And so if anything goes wrong with the retina, your vision tanks really quickly. Mm-hmm. And so if you don't catch that early, it's not fixable. It's retinal. It's a nerve tissue, which we can't regenerate. And so having things checked out on a yearly basis just to make sure everything's healthy and normal and there's no problems is the only way to go, really. Mm-hmm. As far as the eye functions, it's kind of set up as a camera. You have your cornea at the front, you have the human lens just behind the iris, and you have your retina, which is like your camera phone. Mm-hmm. And then all the billions of photoreceptors in the back of the eye put off a little wire called an axon, and those axons flow back to become the optic nerve, and the optic nerve flows all the way back through the entire brain into the back, the occipital lobe, and that's where vision is processed. So you can pick up a lot of things from an eye exam, simply said.
How often do you recommend getting a checkup?
Once a year, absolutely. Mm-hmm.
Can you tell us one of your most difficult situations that you have encountered, or a patient that stood out to you compared to other patients?
Sure. I used to work for a big ophthalmology group here in town called Texan Eye, and I was the medical director out in their Lockhart office, which was out in the country. You saw a lot of interesting things out there. I had this elderly lady came in who had a tumor hanging out of her eye. It was attached to conjunctiva, which is just inside the lid, but it was hanging on her cheek, and it was about the size of a golf ball. And it was fungated, which means it was multicolored from fungus growing all over it. And I asked her, she was checking in, I happened to be up front, and I'm like, what's that? And she's like, oh, an ant bit me. I'm like, okay. You just kind of step back because patients say some crazy things sometimes. But yeah, she had this big tumor hanging out of her eye. That was the only time I ever worn gloves when I did an exam. It's not going to touch that thing without gloves. And so, she wound up, she had really, really dense cataracts in both eyes and she couldn't see. And so her son had brought her in, and I kind of talked to him about it, and he said, no, it's been there about 6 to 8 months. No, it's not new. It's like she talks about it being new. And, the reason being is she really couldn't see it, I think. And so we sent her to the proper specialist. They cut the tumor off. It was benign, simply said, so it wasn't a problem. It was just a little tumor, and they did cataract surgery on her, and she could see properly. And so it was a good outcome, simply said. But that's one that stood out in my mind just because it was very irregular.
When performing these procedures, how do others assist you in the process?
I really don't really have any assistants. If I need an assistant for children, is the only one I probably use assistants for because they fight you on the drops. And so parents are usually the assistant on that. If I need more, then I'll ask somebody else to come in. But generally speaking, most patients, for what we do, we don't really need an assistant.
Can you tell us about how the history of optometry has evolved since you began?
Oh, it's changed a lot. How far back do you want to go? So optometrists were jewelers to start with, essentially. They made glasses, and they were also jewelers. And they kind of formed an optician's type setup to where they could do the refraction part of it, where they could check to see what the glasses needed to be. And from there, they kind of have fought over time legislatively to get more rights to where we can do slit lamp exams. We weren't able to use topical medications in Texas anyway until like the late 70s, where we could dilate somebody's eye. And then in the 90s, we got where we could start prescribing antibiotics and other things for the eye. And right around 2000, we got to where we could actually do glaucoma care here in Texas also. We can prescribe different drops and oral antibiotics and things like that also. So it hasn't changed too much since then overall.
Can you tell us some of the new things that are coming into the picture for optometry?
Sure. For optometry, again, the equipment is the biggest thing. All the new instruments that are coming out are very interesting. Blood flow analyzers, where you can actually see blood flow to the optic nerve and also to the retina, and analyze how that's working, because there's a lot of conditions that you're trying to figure out what the cause is, and there's nothing else that you can see going on. Blood flow probably is a real big part of that, but we don't have any great instruments to test that at this point. So that's kind of a new instrument that's coming out. It's still in testing, but it seems pretty promising.
What advice do you have for students who are pursuing optometry?
Well, one, you got to keep your grades up. It's competitive get in. You got to be able to pass the OET also. Watch student debt, because that's the other biggest issue I think for a lot of students right now is student debt, because grad school is expensive. And so you got to make sure it's going to be worth, when you get out, what kind of debt you're going to be able to pay it back. That's my advice on that one.
And then before we end, do you have anything that you can show us that optometrists use on a daily
basis? Yeah, we use the phoropter. It's how you check how to get people to see better. Simply said, it's got lenses in there, and you kind of flip them, and it's called bracketing. You give them one above, one below, and type of thing until it's just right. Subjective testing. The slit lamp we do on every patient also. The slit lamp is just a big magnifying glass. Allows us to break down different tissue levels for different structures and take a good look at things to make sure everything's healthy.
So you said that you treat patients with glaucoma, right?
Mm-hmm.
So how many patients do you normally come across with glaucoma, and how do you subdue the...
Well, you basically, when you're looking at glaucoma patients, usually you look at them, there's no symptoms for glaucoma. It's symptomless. And so usually you're looking at the optic nerve in the back of the eye. Glaucoma is an optic nerve disease. And what happens with glaucoma is you have cell death. And as the cells die, the shape of the nerve changes, and it loses fibers. The nerve coming out of the back of the eye is just a big cable. And as you start losing those cables, the shape of the nerve changes to where you get this big pit or crater in the middle of the nerve where you have all these missing nerve fibers, simply said. So you look, and when you're doing the exam and doing the fundus exam, you're looking back there and you're looking at the nerve going, well, that looks like a sick nerve. And from there, you kind of start the conversation with the patient, if family history or not, any other factors like diabetes, hypertension, other things that can contribute to it. and you start other specific testing for glaucoma to confirm that's what it is. And the OCT is one of those, a visual field exam, and we do fundus photos just to keep track of how the nerve appearance is.
So do you know any like factors that can influence like the health of the eye? Like would you say that there are certain factors?
Smoking is bad for you in general, and there's a lot of things links as far as like glaucoma, macular degeneration, cataracts. To smoking, eating a good diet. Bad diet can definitely factor into that. Protecting your eyes from things like laser pointers and stuff like that. I had a patient that came in that was blinded by his friends because he got drunk and passed out, and his friends thought it'd be funny to shine a laser pointer in his eye, and they burned a hole in the back of his eye. And blinded it, simply said. So, there's, obvious things. But then, not smoking, eating a good diet, protecting your eyes, UV protection outdoors, good thing, especially here in Texas where it's sunny out a lot.
Yeah. Do you think like a certain gender or like a race is more vulnerable to like eye diseases?
Yes and no, and that statistically certain races are more vulnerable to certain diseases. Caucasians, macular degeneration. African Americans, glaucoma. Asians, glaucoma. And so why that is, we have no clue. It's just the way the statistics have panned out. And so when you're looking at things like that, you kind of look at the race to see if that's an indicating factor or not.
When you talked about the diet, how that can also affect it, which foods are like more?
Well, healthy foods like green leafy vegetables that have high antioxidant counts, simply said. Fatty foods cause arteriosclerosis and blood hypertension, things like that. They definitely affect the eye. The eye is the only spot in the body we can actually watch the cardiovascular system work. We can watch the blood cells flow through the blood vessels. And so when you have hypertension and arteriosclerosis, you can see the changes in the blood vessels that indicate that. So that's definitely how it affects it.
Okay. I think that's it for our interview.
All right.
Thank you.